So we have been instructed by the physician that we need to do some airway clearance for our patient. And so I'm going to knock, enter, introduce myself and my department to my patient. And then I'm going to do an assessment, which includes vital signs, lung sounds, SpO2, and an overall assessment of appearance. I'm going to wash my hands, and then I'm going to explain to my patient how this PEP therapy works. So, hi Mr. Jones, I'm Tori with Respiratory, and I'm here today to help you with some airway clearance therapy. This device that I have here is called a Coronet, and so I'm going to show you how to use this so that we can get those secretions up and out for you, okay? So, your doctors recommended this device, and so we're going to start on the first setting for resistance here. And what this device is going to do, I'm going to have you take a deep breath through your nose, deeper than normal but not as deep as you can, and then I'm going to have you seal your lips around the mouthpiece here, and I'm going to have you exhale fully and completely through the device. Now you're going to feel kind of a vibration coming back to you when you exhale. And you might feel like you need to cough, but what I want you to really try to do is to continue and exhale fully. And then if you feel like you need to cough, instead of doing a full forceful cough, I want you to do what we call huff coughing, which is like this. What that's going to do is it's going to get those secretions out from the bronchi, and it's going to move them up to the larger airways so that we can get those expelled, okay? I'm going to have you do this 15 times in an hour. So I'm going to have you go ahead and I'm going to go ahead and have you do that for me, okay? All right, very good. Now I want you to go ahead and do that huff cough again. Good. Okay, I need to reassess. So I'm going to listen to your breath sounds again and get your vitals and your SpO2, okay? It is important that you understand that sometimes your breath sounds might get a little worse than they were at the beginning, but that's okay because that means that those secretions are moving out of the smaller airways and into the larger airways, and that means that you're going to be able to start coughing those things up. So that is a good thing in this situation. Do you have any questions for me today? Okay, well, I want you to try to do this about 15 times every hour, and then of course when you're done you just take some deep normal breaths, okay? All right, and if you can cough anything up, let's just get it up and out, okay? All right, thank you.